So we want to start off by giving you some feedback about, actually feedback that you provided us about accessing the early learning system and some of the key questions we need to be attentive to as we do that. You had a homework assignment that's represented on the meeting agenda in front of you as well, and we want to give you a sense of your responses to all of that. We also really want to dive in and identify some core principles, I would say, for selecting incentive metrics for the hubs, because that's kind of the next really concrete set of tasks that the Early Learning Council needs to, related to this committee's agenda at least, or charge, really needs to roll up our sleeves and work on, and the council is expecting to hear from this committee before we do that. So, and that's coming up straight away in the fall. And then if we get time, we also would like to at least have a collection of potential metrics that could be considered for incentives, just as a way to seed our next conversation and to allow staff to do some work between this meeting and the next meeting. So that's what we hope to accomplish. By way of doing that, we have a formal agenda. I don't need to read it to you. It's on the screen in front of you. You also hopefully have a copy of it because it came out in advance with material. So let me stop and see if there's anything that you think that we need to add to the agenda that's not somehow represented in the materials that you received. Okay, so hearing none, we're going to go ahead and launch into the agenda. Before we do, I know we had a couple of folks join us that did not have a chance to introduce themselves before. So Colleen, would you introduce yourself? Please.
Hi, I'm Colleen Ruland, and I'm the director of the Oregon Pediatric Improvement Partnership.
Thank you so much. And I think Melly joined us. Did I see Melly join us as well?
Yes, I'm here. My name is Melly Bukowski-Reyes. I'm the Executive Director of Playology Oregon Educational Consulting here in Yachats.
Great. Thank you so much. Did I miss anyone? Did anyone else join us? Okay. Great. We're going to go ahead then and get started. And the first thing on our agenda is to, let me just kind of set some context. You might remember that at the outset, we did a little bit of review of the statutory goals for the early learning system. And you'll remember that there are 3 of them. And we've been diving into kind of a set of potential key questions for measuring success under each of those goals at each of our meetings. And so the key, or they set the structure of how we are planning to proceed. So the key, that's one of the things we want to take on today. And the key questions, or potential key questions in front of us today, have to do with how we're addressing impact of services that are delivered for kids who are furthest from opportunity.
And this was this first set was the set that we discussed last time, and this was the sort of revised version based on the input from that this committee gave us.
Perfect, thank you. So why don't I turn it over to David? Obviously, that's a perfect transition. And he can pick up with the input that you gave us.
And so, so what we wanted to do today was, one, make sure that the revised version captured the input that we got from you for key question area 1, and then also dive in and have a similar discussion and get input for you on what we're calling key area 2, accessing learning. And I'll hand it over to Tom.
We're just going to go down the road.
So get ready.
Denise, you're next. On the note taker.
Do you want me to read them? Well, I guess I just folks for this one, I just take a look and make sure that this captured the discussion from last committee's meeting.
Great, Debbie. Did you?
I wasn't able to be on that one, but just maybe you'll learn really fast that I've got kind of this is kind of all new to me. I mean, I'm involved in the early learning part because our behavioral health promotion and prevention, we're trying to shake that world up and realize that addictions and these kind of things are really a pediatric type disease. And so we've completely changed our focus. So as I was looking through these, that first one, 1.1, just maybe a clarification for me where it states impact children's developmental progress. What's that developmental progress? And I know I watched the webinar and everything about the ASQ. Is the SE, when we're talking that developmental, are we talking about that part included in that, or just, what the ages and stages questionnaire does? I don't see anything in our paperwork that says the social emotional part.
And these questions, I think, are supposed to be at a pretty high, broad level, so they're not intended to reference any particular
understand that.
measure. And at least my understanding of developmental would be a pretty broad understanding.
Okay. And that was just my question, hoping that's all inclusive.
And I think it would cover the gambit from health, social, emotional, cognitive
Perfect.
Development.
So Debbie, the founding documents for the Early Learning Council Division and System in Oregon, we slice and dice this lots of ways, so it's good, better, and different. We have 5 developmental domains that we need to pay attention to. Social emotional is included in those 5. And so, to David's point, it's a broad view in those 5 statutory areas. What we haven't gotten to yet is how do you actually measure it?
And that's perfect.
One of the questions.
Without being on that, I wasn't sure, so I just wanted to clarify that. Yep. So that answers perfectly. Thank you.
Yep. So I think what we're trying to do with this is just because we looked at, to David's point, we looked at like the kinds of questions that we would potentially want to ask under this bucket, if you will, and these are the questions that, or the feedback that you gave us, and then staff took and revised them. So I think what, to David's point and Tom's too, what we're looking for is whether this accurately captures your feedback at this point.
And in terms of the use of these questions, I almost imagine these as sort of creating a virtual drop-down menu, in the sense that when we get to a specific program or a sort of specific area, you start to flesh out for each of these questions how would you ask that question in a particular arena or space. That sort of makes sense. These are supposed to be the high-level questions that sort of help us guide work as we move forward.
So as I looked at this, Pam, folks on the phone, a question just kind of crosses into the how do we measure it a little bit, and I don't want to take us down that bunny trail, but if we're not thinking of it in this way, I may want to provide a little more feedback here. So there's this, how do I say this? There's a question for me about whether the hubs are actually targeting, so our key question has to do with kids and their development, particularly kids who are furthest from opportunity, right, which is the language, the shorthand that we've been using for the kids who are identified in statute as risk, which is who we're supposed to be targeting. So there's a question about, are we actually targeting and serving those kids who are furthest from opportunity?
That's a great transition to the next slide and the next set of questions.
I'm really good at transitioning to you today. Okay, great. So I'll hold that, but let's see if there's any more on this one.
Okay, David, I have a question, though, on my reading of this, and it maybe helps by the time I got to the third one. But I doubt there are many people in Oregon who know what the state-funded and affiliated services for supporting development are, and could even catalog them accurately and know who they are available to and who accesses them. So I had problems with this because I was struggling. I know we're staying at the high level, but it's kind of like, how can we do this when people don't even know what we've got?
It implies early learning services.
It applies a system that now currently does not operate as a system. And I know we're going to get that in your third area. So it may be just that for me it'd be easier if you reordered and put 3 first, but it's really hard for me to think about anybody answering these questions at the high level or at the detailed level, given where my perception of where we are in our knowledge.
So Bobby, it's Pam. Just let me ask a couple of clarifying questions. want to make sure that you're on the bucket of questions for key question number 1, right? So
Yes, I am. Yes, I am.
And I think what you're saying, let me see if I've got it. I think part of the questions that you're asking is, has to do with the Uber question at the top about state-funded and affiliated services. And I think what you're saying is, folks who are not speaking, could you mute your phone kindly, please? We're getting quite a bit of background noise.
I'm sorry for your cold.
Yeah, right. Right. Tom feels sorry for whoever has a cold there. All right, so I think part of what you're saying has to do with the state-funded and affiliated services and an assumption that A, we know about those services, and B, they're operating in a coordinated fashion in order to answer the sub-questions. Is that what you're saying?
Yes, exactly. It's like this, in order to answer this, you'd have to know that. You can't say if they're having an effect if you don't even have a good handle on what exists and for whom it's available and who it's not and who accesses and who doesn't. And so it feels like if at least it's out of order. And feels like, how could people possibly answer this?
And so when you say number 3 maybe should go first in terms of the order, you're not talking about 1.3, you're talking about key question 3.
Yes, I am.
Okay. As people were confused, some of us in the room thought you were talking about sub-question 1.3 and we couldn't figure it out.
Oh, I'm sorry. No, I was talking about key question 3.
Okay, great. Thank you. That makes a lot more sense.
I'm sorry.
Okay. No worries. So I think I'm hearing multiple sort of sub-suggestions in that. You've articulated the reordering question, but there's also a question, and it was kind of underlying part of what I was asking about too. What information does the state, if you will, need to provide to local communities and hubs in order to prepare them for working on these question scenarios? Did you want to add?
Well, I think you may have just answered my question. My question was who's the audience for this? So it sounds like it's the hub.
Well, the council is responsible for answering whatever set of questions we put together at a statewide system level. We're accountable to the governor's office, and in particular, we're accountable to the legislature to answer these questions. But the hubs are going to have to answer their questions for their jurisdictions as well. So they kind of, in the best of all worlds, they roll up.
Okay, thank you. That's helpful.
In my mind, when I was reading ahead through 1, 2, and 3, I was thinking about Bobby's point. Like 2 is my thought what would go first, the accessing part, and then 3, the system coordination, and then back to 1 of the impact that it has on the children and the family. That's kind of like doing it in that order, and then going back originally to the concern being, how do we know we're reaching the children and families for this opportunity? I really kind of liked like 2.5. That question started off with it first, like what are the barriers preventing it? And then I enjoyed, my head was rolling from like, what are the barriers first, or who, where are they, who are they, what are the barriers, and then rolling forward to like offering that information for the accessing, and then coordinating, and then going further to the early learning, or the impacting the development. And the part that I liked in that is the 1.6, like how do I know when they're in my tiny little program that I'm reaching the families for this from opportunity. And the way I know that sometimes I'm not, because those families are saying thank you, like the continuous improvement around engaging those families who keep saying those thank you. Like, is there a pattern?
So part of what we're saying here, I think, to staff is, yes, you've gotten our feedback so far, at least you're in the ballpark, and we have some, this is not intuitively logical in its flow to us as a committee, and some of that is the order of the Uber questions, Bobby's point, and some of that may be that we think some of these sub-questions belong under other Uber questions. Have I got it?
Yeah, and I think the question, yeah. I mean, like I think the order, like way down to like just being the supervisor of a home visiting program where families come, it does look out of order. I start like with the accessing first, and then the coordinating, and then the working with the families. And the questions do seem actually relevant in each one of those subsets. I wouldn't reorganize those necessarily.
Okay, well, so let's focus then right now on any further comment about the substance of these sub-questions, and then we'll move to the next bucket. Any further comments about the substance of these? Okay, now we can go to my transition to David and go to the next set of questions.
And can I also just sort of make a process suggestion based on what I'm hearing? So we've been sort of going through section 1, trying to break it down just to make the work more manageable, but it sounds like after we've gone through in individual meetings all the 3 sections, we should probably then step back and look at them as a full package.
Yes, right. I think that's a great idea.
Right now.
Okay.
Okay, so key question 2, access to early learning services. Are early learning investments prioritized to reach those furthest from opportunity? I don't know if I captured the essence of are they prioritized correctly, but at least in this one, it's probably the only one where it's like, oh, let's try to organize these in a logical fashion. So this was I redid these from my first draft. So 2.1 are state-funded affiliated services located in communities with high concentration of children from furthest from opportunity. Is there evidence of demographic characteristics of those kids and families indicate that the investments are reaching those furthest from opportunity? How are the early learning services engaging children and families? Are children and families able to seamlessly transition among early learning services, or do they sit on wait lists for a long, long time? And what are the barriers that prevent some people, some children and families from even participating in some state-funded services?
I apologize again for kind of being late to the party. This phrase of furthest from opportunity, and I think you kind of mentioned it was kind of that are at the most risk. Is that, have we come up with kind of a, a definition of what constitutes that?
Yeah. So again, there's a statutory definition,
okay,
and it's super long.
Okay,
and so this is our
might be
bumper.
looking for that, because it sounds like that's where I really need to catch my stuff.
Yeah. So if somebody can send it to you, I don't have it.
Okay, that'd be perfect.
But
I don't want to keep bumping it, but
I'll send it to the whole committee.
Okay, great. 3 paragraphs long.
Okay.
And it's and it's like anything you want to talk about, including the issues you care about in terms of behavioral health is in there. Yeah. So this is our bumper sticker version.
Well, I like the sound of it. I mean, you could then throw everything in, so I like it better than at risk and stuff. So just.
Well, and I think part of why we have it is we can talk about at risk, but the reality is at-risk kids don't. We want to tie it to what they're at risk for, the opportunities to succeed that.
I like it. I really like the term.
What other feedback do you have about this bucket? Is 2.2, well, maybe let me ask it this way. Isn't 2.2 how we would measure, not what we would measure? So by my way of thinking, we're looking at engagement, we're looking at transition, we're looking at barriers, we're looking at targeting, hot spotting in 1, 3, 4, and 5, and 2 seems to me to be how we would measure some of 1, 3, 4, and 5. Does that make sense?
Yeah.
It's a conceivable metric for.
Right. And I kind of wrestled with those two. Are they really saying the same thing, 2.1, 2.2? Is there a better way to merge them together? But I agree that that's really a kind of a measurement piece. I didn't know I thought it was only 4 things. I was getting too brief.
Well,
I better add another
well,
one.
and actually, I feel bad sort of jumping in on this on the key question, but I had a question about the key question that might actually get back to this.
Yeah.
I'm wondering if the key question is, are early learning investments prioritized, which is a really important question to reach those furthest from opportunity, or are they reaching those furthest? Because you could actually have investments that are prioritized, and that's an important thing to know about, but actually not succeeding in reaching the populations that you're talking about.
Well, I like that, David, and then it makes me wonder if the prioritization isn't one of the sub-questions.
That's what
Yeah,
I'm thinking.
yeah. I think that's the better way to think
I
about it.
have a little bit, like I think I printed off something that was sent out.
And Tom did a little bit of cleaning up even before then. It's what a moving target.
They didn't mind the old question, the old 2.2, which was how are the early learning services engaging children and families furthest from opportunity?
Yeah. I like
Now
that.
it's 2.3.
Yeah. Oh, okay.
Yeah,
Okay.
that's what, yeah.
And then there was one that was totally different.
But I really strongly agree with that kind of making this sub part, because developmentally where, I know you're looking across early learning but then developmentally where I'm seeing hubs are, we're still like, what programs should we prioritize, what programs, and then there's the question of like, is this having the impact we want to have? To roll them all together doesn't seem to respect what we talked about in the last committee of knowing that we need to take that phased approach. So I really like that idea.
I like that too. David, will you re-say that so I just capture it to the notes?
Are early learning investments reaching those furthest from opportunity, and then add a new 2.1, which is, are early learning investments prioritized to reach those? Right. So first you want to know, are we putting the investments where we think they matter, and are those investments actually reaching those who they matter?
Anybody on the phone want to jump in and have any, feedback before we move to the next slide?
Yeah, I want to go back to Bobby's point, and you know, I think that there's a descriptive question that needs to be vetted and fleshed out, which is one of just describing what are those early learning services. I mean, I think, you know, when you look at that first question, as it became apparent, you're then predicting out its impacts, and then the question mark of, well, what are we asking questions about its impacts? And so I think maybe early in the current, you know, 2.1, 2.2, I think just could be a descriptive questions of what are those services that are those early learning services, and then the questions around who's accessing them and where are they being accessed, I think then narrows the question.
Okay. Thank you. I think I'm going to start recording.
And you were worried that this list was going to be too short, Tom.
Oh, it's being recorded? Oh, good. So I can go back and listen. Oh, great. Perfect. Thank you. Other folks on the phone, other comments that you might want to make?
This is Melly. I've been typing mine in. I agree with the last statement that was made. I mean, that's, if you could even produce that eventually onto some type of hard copy paper thing that goes into a nursery basket at the hospital, that'd be for each county that the child was born in, that'd be incredible.
Great, thank you. Yeah, obviously there's layers here, right? And again, by statute, at the council level, we're prohibited from running programs. So we're not going to drill into that level. That drill is going to happen at a local level where communities are delivering services. But okay. Great. Should we move on to the next slide? I'm going to be a little bit of a timekeeper. So I think this kind of starts to shift us into our next topic. Before we do that, anything else on the two key questions so far, the Uber questions? And then remind me, do we have one more look at this next time with the other questions?
Yeah, that was the plan.
Yeah. So we have one more bite at the apple, if you will, where we're going to come back and look at the third bucket of questions. And then to David's point, it's really important probably that we look at the gestalt at the end after we've done all of the messing around and make sure that it all fits.
So I This is Bobby. I'm not quite clear. So there's that third large question about early learning system coordination. Is that what you're saying? We're going to go now to something else and come back to that?
We're going to come back to that at our next meeting. So this sort of goes back to the original work plan, and we were trying to figure out how does this committee both do the sort of the immediate task like developing the incentive metrics, but also provide a space to sort of think about the big picture. So what we've been trying to do is have a little bit of that big picture discussion at the beginning of each of these meetings, while also providing enough time to stay on track for some of the tasks that the council has assigned this committee. So the idea is that we've been doing, these 3 set of questions once at each meeting. So we would do the systems coordination our next in-person meeting. Does that make sense, Bobby?
Okay. Yeah, that's fine. I just want to say that 3 together, my major issue is that the order doesn't work for me, that the third being first and maybe the first being last. Someone said kind of capturing how effective we were, but it's what Andy just said. I think what number of people have said. These questions kind of have an assumption that we know what is there, and we have so much evidence that very few people do know what is there, that before we see it again, it would feel really important to me that piece somehow be articulated, changing the order or in some way, because it kind of makes my mind crazy to talk about what effect things are having when we're asking people to say what effect something's having when we know they don't even know what those things are.
Yeah. So
that's fine. I'm ready to move to wherever you want to take us. It's just that I didn't want to lose that.
Yeah, Bobby, it's Pam. I think that's really important, and maybe a note to David and Tom. I mean, I think part of the question that you're not asking it as a question, but part of the question for me then becomes, first of all, I agree with you, but part of the question for me then becomes, what is it do we as a council or the division, what information do we provide that provides some framing for these questions? And what information do we expect hubs to provide? So for example, I would hope that we as the state entities, the policy body and the agency provide hubs with information about the state services that are in their community, as well as a demographic picture. Hubs are going to know more precisely, but we can provide some population data, and we should provide that. Yeah. So right. To me, that's inherent in here, and maybe we can, when we look at the Gestalt, David, we can think about that as part of this. Does that make sense? Yeah. Okay. All right. So we'll come back when we look at the kind of how we weave it all together and have that conversation. All right.
Thank you.
Yeah, thank you. Really important. So now we're going to shift gears, folks, and at the last meeting we gave you a homework assignment. And what we're shifting gears, what we're starting to pivot to now is starting to think about the measurement of success of all the 3 goals, kind of how it starts to fit together. And in particular, the council set a policy and set aside 5% of funds for metrics, for financial incentive metrics for hubs in this biennium. So this is kind of the context that helps to get us to start to think in that direction, and that's the pivot that we're starting to make with this next slide and question. So the homework that we gave you is to say, if you had to pick only one thing out of all of the gazillion things we could pick, but you could only pick one that would indicate to you that the hubs are really fulfilling their role in the way they were intended to fill their role across all 3 goals: the coordinated system, supported kids who are attached to secure and supported families, and kids are ready to learn when they enter school. Those are kind of by shorthand. If hubs are really functioning in their communities to deliver on that, what's the one thing that would tell you they were actually functioning? And this, what's on the slide now in front of you, not everybody responded, but 6 of you did, and what's on the slide in front of you is what you said.
With 3 disclaimers, because I apologize, I did my homework, like, I felt like I was in college and I did it at midnight the night before I was it. One of the disclaimers for me, and I asked it of you, is if you were asking me what could be measured, like, I would answer that differently if you were asking me what is one way you would know they were fully functional, their roles in achieving their 3 HEP goals over the course, like where we're going, or like as of right now in this time period, I'd give you a different answer.
Yeah.
And if you were asking me what is one metric that we can measure now and put an incentive on in this year, I would answer you very differently than if I was answering that broad question. So that's just one contextual, that if you're using it to inform of the metrics that hubs are reporting what should be incentive, the question didn't, I didn't answer that question with that filter. And so don't get frustrated later on if I give you a really different answer because I wasn't using those really important feasibility design parameters that just are the reality.
We didn't ask you to.
Okay. I'm trying to make sure.
And you're not the only one.
Okay.
So this is really kind of hard to answer.
Well, because it would depend on what the range was. Yeah.
Well, we didn't ask you to, but I think part of, so I'll just, part of how I think about this is, and maybe it's just a style about how people come to think, but if we don't understand in a broad sense where we're trying to head, then how we measure, even in an incremental way, progress towards that, like right now versus where do we really want to be? I think we have to understand that piece first. So that was part of it, at least how I think about it.
Well, I didn't fulfill my homework assignment because I really felt like I needed to catch up on a lot of stuff. And already, I mean, you guys have been great with this, what I've been hearing. And I don't know if this necessarily fits in with this, but and maybe I'm looking at maybe 100,000 feet now. But some way, whether it starts with the learning, early learning division, but ultimately having, all of our children have this opportunity to become responsible adults. Are we, I don't want to get too caught up on, incentives or, reading and things like that, but if we're getting that great first start, and then we tie it into whatever this first through 12th grade or whatever, how they're going to divide those up still, are we seeing down the road 10, 15 years, not that this group has to tie that in, but if this is a group that's going to say, hey, we don't want to just stop at this 0 to 5, but let's make sure we're linked in, so we can come back and say, this work mattered, and this started it. I don't necessarily know how you do that, because I don't think it's ever being done. We're in those silos, but to me, this is that opportunity. If this is the voice that's ahead, the hubs are ahead of the group. We have a grant through the youth and development. I'm not sure, and they're still behind, and you guys are so much further ahead of them. Taking that lead, because I think we all want to look at, hey, we've got more graduates, and it's all going to start because of the work that's happening here. If there's a way long-term to just make sure in the back of our mind, hey, we want to link these up to this so that we can really tell that big story.
So what's your feedback about what you said? This is, oops, other way, Tom, sorry. There, oh, there you go. Nope, there it is. Don't touch it. Don't touch your computer. Really sensitive, isn't it?
Yeah.
All right, so what's your feedback about this, folks? What are your feedback about what you all said collectively?
Well, this is Melly. I have to agree with the question part, and I know we went past that already, but in seeing for our county and our learning hub, last year we started with a change in our kindergarten program, and it became more of a play-based structure. So for us, and I don't know what other counties might be doing, like Lynn and Benton, but I know that within our care resource and referral, we're collaborating with community programs, in providing trainings to help providers reach steps within the Oregon Center for Career Development to enhance their professional training. So that's my rationale for choosing goal number 2.
This is Bobby, and I did not do my homework. So what I would have said, that, and I don't see it here, so I just was going to add it now. For me, these early years are about creating a real collective impact. So I would want to know, is there one thing that 5 or 6 of the sectors would own and have in their own set of goals that is shared amongst all the partners? It feels like all these other things are going to come down the road, but we're not going to really change Oregon if at this time we're not getting people to see, the sectors, to see what they share, and that without working together, we're not going to really change. So if you want, I'd play with words, but I don't see that there, and it remains, for me, the most important thing the hub has to do.
So, Bobby, it's Pam. I want to second that. I didn't do my homework either, and I didn't do it on purpose, because you and I both get another bite at the apple of the council when the council is trying to figure this out. I wanted to see what everybody else said, but I have the same perspective that you do. I think that there have been, so I'm dating myself, but I've been around this stuff in Oregon since the 80s. And there have been multiple efforts to try to do all of this stuff. And where, from my perspective, historically we have fallen down is that we jump into a focus on services before we understand the foundation that needs to be laid in community about how people work together to support and take ownership for the results for kids and families. And so yes. I'm worried that if we jump too quickly to issues related to services or issues related to agencies or issues related to access, which are all really important, but I'm worried that if we jump there right away, that's the imperative, and then we miss all of this other stuff and we miss the chance to turn the ship a bit. So I really want to second what you have to say, and the closest to that that's up there is the third bullet, although it's not exactly.
And that was mine, and that's what I was trying to capture really quickly from a hub perspective, that, you know, the amount of relationship building that it takes to get to that true collective impact. And if I were to think about the hub system right now and thinking of it as if right now, where we all come to this from such different starting points in our communities, what would be the one thing? It would be that all of the sector partners are engaged. Because before you can get to that true collective impact, they at least have to be engaged in it. And many are still struggling with getting all sectors engaged in the work.
And Christy, so I would say it goes, even in the early years, goes beyond engagement, and this is not the right word, but it seems to me it is engagement, but it's really taking ownership. In some specific way, and it's the perfect example of where the whole is greater than the sum of the parts. That's what I think it is. I don't know how you measure that. That's what I was trying to about it.
Where I was like, it's not just that people are engaged, but like you have it defined, like it's very clear. These are the partners. You've identified your shared vision, and that isn't we're going to do just this part. It's like our vision for children in our community is this, and we all agree we're going to work collectively to do this. And you, that's what I meant by defined vision. But then I also meant that like you've defined who your population is, because you can also say we're all going to work to do this, but until you like track a population and see if it's having an impact, then you can't actually know whether your vision is being achieved. So I agree. I think there are similar. When I look at bullet 3, 4, and then hear your comments, I think they're of the same thread.
Does anyone want to make an argument that it should not be that? Some version of 3, 4 and the comments that have been made. Does anybody want to argue that at least in this biennium that we're in now, that's the thing that would indicate to us that the hubs are starting to be functional and fulfilling their role? Anyone want to suggest something else?
I just think that what you said and valuing that experience from so many of you, this is an opportunity to do something different and not be the same status quo. And I know I'm a member of some other committees that are just fighting that, and maybe that's, you've answered, you know, what's the missing piece that we just haven't been able to get to. So I'm 100% behind that.
I did lots of thinking on all the conversations had, and then did think that we needed to go concretely into finding a metric. So I chose the first one. I put 1.4 because that was the metric that felt the broadest to me and included baseline data to measure against. So I did all that thinking, but still needed feeling like I had to get to a concrete
How would you know?
line. Like how would I? So that's the one that because I wanted to find one that was the broadest and the most inclusive, and that communities could define on their own. I know that there's an ELD definition of priority population that all the hubs follow. I think that each population looks different within each region. So I liked having the flexibility and the definition of a shared vision being described within that community for that population. So I just landed on one that was super broad and super, like, what's baseline to measure against. Because I was thinking back to when Sarah was here, thinking we had to have like a data point.
Although wait till we discuss how it's operationalized.
Yeah.
Okay.
Well, so I mean, the prevailing conversation so far anyway is that if we could find the data points, right, if we could figure out how we're going to measure it, most of us so far have sort of jumped in I'll just shorthand it to say co-ownership and collective impact, kind of whatever it is. Could you agree to that, Emily, or?
Yeah, I was thinking that like co-ownership and collective impact. There are parts of what you said earlier that should be included in that, and I was trying to recall it in that moment too. Because I do think you're right. It's like the ownership part. It's not the finding the things, like, you know, when we're talking about accessing resources. 211 has a new Help Me Grow. Like it just like there's always something new, and we need to go all the way back to the shared vision, but still keep the individuality of the community.
Right.
So it seems from the reading I've done about communities that have been effective in acting collectively, they select probably one thing. And it seems like maybe the hub would have to name which one really engaged the CCO, the school districts, the car salesmen, you know, or whatever, the car dealerships, the Chamber of Commerce, whatever, and evidence that whatever that one is in their documents. That they're not just saying yes, they are putting it in their own measures of success for themselves, so that it's truly, we've truly got people all rowing together, that they, and it seems over time, if people have success, they'll be more convinced to do more. But my guess is you could only get a community to really do that, or the examples I've seen, they only do it on like one thing. They don't try all these different things, and I don't think we should tell the hubs what the one thing should be. We might give them ideas of what it might be, but it's what is going to excite the sectors in your community enough that they put it in their set of goals and they measure their own success with their own resources in moving.
That's exactly right. That's exactly my vision of it, Bobby. It's Pam. So here's my analogy, and so I like your analogy. Here's mine that I've been thinking about in my head. So if anybody knows anything about, does anybody know anything about ballroom dancing? So that's my, yeah. Okay, are you a ballroom dancer?
I was in a past life.
All right, well, great. So okay, so for Denise, right? So if you're in a ballroom dancing competition, first, usually a man and a woman. So usually, the man comes out and he dances and he proves that he's a capable dancer in and of his own right. And then the woman comes out and she does the same thing. She's a capable, skilled dancer in and of her own right and self. And then they come out together and they engage in something that neither one of them could have engaged in by themselves, even though they're perfectly skilled and capable. And that it's that dance together that I think is what measures, to me anyway, the hub, right? So, but because my fear is, maybe to your point, Emily, earlier, my fear is if we start refining, oh, no, don't put your feet that way and you got to adjust your whatever, right? Then we lose the opportunity for that beautiful dance that can occur between the two of them. So I don't know how we exactly measure it or exactly talk about it, but that's what I think about that we're trying to get to.
Well, I think what I hear is mutually reinforcing activities. And even if it's just the one mutually reinforcing activity and collective impact that they choose, and then move forward from there, but that's the starting place. We all agree this one strategy, this one set of activities, and then move from there.
It seems like mutually reinforcing activity is one piece of it. What I hear you saying is even more than the activity, it's even that as you're thinking of yourself, that all those other pieces are in your consciousness. You walk around with that. How do you measure that?
Well, I actually think Bobby gave us some ideas about how to measure that. I wrote down a few things that she said that we had little seeds of measurement in there, so I'll come back to it when we're ready for it. But does anybody disagree? So we're dancing around, pun intended, we're dancing around the content, an idea. Anybody disagree or want to make an argument for a different direction for kind of what indicates to us, at least in the near term, maybe also in the long term, but in the near term at least? Okay. Going once?
Oh, just let me jump in here briefly. It worries me a little bit that the emphasis is on sort of processes and coordination rather than a focus on services to kids or some sort of outcome for kids.
Was that Brian?
Yes.
Okay, thanks. Brian, it's Pam. Do you have any thoughts about how we could tie that or wrap that in this?
Well, I mean, sort of the way I'm thinking about it, the question was about hub goals, and the way I tend to think about these things is that you have goals and then you have strategies that guide what you do in order to achieve your goals. And the, building relationships and coordination looks like a strategy to me, but the goal is really about improving and expanding services to kids who need them the most. It's not to say that the strategies aren't the key piece. They clearly are, but they're different than your goal. And maybe that's okay given where we are in this discussion, but I don't want us to lose sight of the fact that the reason we're doing this is not just to be well-organized systems, but to be well-organized systems in order to achieve something very specific. And so, we could be very organized and collaborative and all of those good things, and if we're not focused on the right things, then our then our goal may go unmet. So I'm not sure how to tie them in other than to say, you know, we want to make sure that this is all coordinated in a way that promotes our underlying goal.
Which for me was around like that you have a defined population and defined metrics that you're using to evaluate progress on your vision.
Yeah, exactly. And
then it requires them to not just be vision, mission oriented, but you need to have the other side of the house that makes sure things are going.
Yeah, I agree with that. I think maybe it's just a matter of conveying it clearly in the way we write it. I mean, the hard work is obviously in creating strategies and tactics that are effective in taking you towards your goal. You know, writing a goal is easy. What's hard is how to get there, and I think the focus on that is absolutely correct. We just need to make sure that it's done in the context of the goal.
So it's Pam. I've been taking some notes about, and I have a concept, but I don't want to put it out until we get a little bit further on in the conversation. So in terms of how we were planning to have the conversation, we've had this part of the conversation. We also wanted to have some dialogue about kind of what are the principles, or what are the what guidance might we have as a committee for the Early Learning Council in selecting at least one incentive metric for the near term for the 5% withhold. And let's go to that next, and then let's come back and try to weave this all together. I think the plan, correct me if I'm wrong, David, but I think the plan would be to come back to this at our August meeting with a, something that's much more well articulated and defined than this conceptual conversation, and we can maybe weave in some of these latest comments about from Brian and others. Does that make sense? Am I right? Is that where we're headed?
And I was trying to figure if I could summarize what here and see if I'm capturing it. So what we're looking for is collective action that's defined by shared ownership over a vision, outcomes, and is also demonstrably tied to, I thought I had a version of this that I was going to make clear as messy, but so shared ownership of a collective vision that's tied to collective action towards a shared goal or shared outcome. I'm trying to figure out how to tie the collective ownership to the real focus on.
I think the only thing that's missing, because there's a difference to me of goal versus population. Okay. So if you just.
Well, so let me try my concept on here, because it's close to what you said. But I tried to wrap the measurement in it. I just didn't want to get too, like, we haven't even talked about principles by which we would select things, and then we're going to talk about measuring it already. So I was trying not to get too far ahead, but so this is a little stale for the concept that we've been talking about, but try this on for size. Is the indicator of success something along the following lines? That the 5 sectors that are required in the legislation have articulated shared goals and strategies focused on a defined problem and a population. And those defined goals and strategies have resulted in, again, it's too sterile, altered missions, budgets, and activities on the part of the sectors, the 5 sectors. Because they're not just coming together and say, yeah, we shared this. They actually have to go back. And something has to change because they have it. And we could go so far as to say they together articulate how it all fits together, or they've identified how they're going to measure the success of that constellation. I was trying to get to the measurement part, that it is about shared goals and strategies reflected in each sector altering how they do work. Is that anywhere in the ballpark?
I keep going back to thinking, I mean, these sound like, kind of you're asking, going beyond, MOUs.
Yep.
We want something that's more meaningful than, you know, just those little rubber stamp things. But it's something where they've changed because now we're really invested in this. Yes. With our heart, soul, and financial and all of that. But, you know, how you make an MOU become something more than what it traditionally has been, I'm not sure.
I guess the only thing that if there is the work that they need to do to go back to their own program, so part of it in terms of the shared data about the population. Does that make sense? So I still wouldn't want EI tracking their population there. I mean, not that EI is necessarily a formal partner, but so home visiting tracking your population, and you tracking your population, and you tracking your population, and everyone showing how they're improving population. Because what we're still missing is like, you guys all serving the same people, or where's the care coordination? And across all of this population, who's still missing, or where are we having duplication of services, or where are we having duplication of services that could be complementary? And so that's my only edit to what you said, is that yes, they do need to go back, but then there still needs to be the contribution of what they're each doing into the collective data that they have about their shared population that they're trying. Because the coordination piece is what is the difference, right? Like, I mean, not the only, but it's what's making this different from past efforts to me.
Pam, I have a question. Is this the vision for where you want hubs to be, or where you want them now? So coming from
right back to the incentive question, right? Because I would say that today. Yeah.
That we have probably very strong what's going on in our region.
Yeah.
I mean, even with the funding, I don't think we would meet that.
So let's use that as an opportunity to transition to the next conversation, which is, like, if we would, I'll just use the analogy, a measurable version of the ballroom dance together is what we're headed toward. What are the principles? And there's some draft principles for our consideration.
These were just the principles that were from the original hub metrics.
Oh, thank you so much.
Yeah.
Thank you.
Just as and these were not designed as principles for incentive metrics,
yeah, right.
but this was just like a starting to the question, which is why these particular questions are on the top and bottom.
Thank you.
But what you want us to hone in is the financial incentive metrics that have to be given out by July 2017 or June 2016. We may give you different answers for 2017.
Yeah. Oh, we did it. It was perfect. It was wonderful.
Yeah. It's just it's the first wave, knowing where we are right now. One of our first deliverables. That's the next conversation. You want us to hone in on that.
When you say spent, you mean because these are coordination dollars drawn by the hubs.
They need to be. Well,
that's not something that this committee needs to worry about. This committee does not need to worry about that. Right? We're not going to. Well, let's not talk about that. What we do need to talk about is what are the principles, again, draft ones for your consideration here, that would help drive how this. So the 5% set aside, if you will, was designed by the council to be an incentive for to do the difficult work that we've been talking about. And so what are the principles by which we would select, the collective, the council, and everybody else, all of you around this table, if you got to be kings and queens for a day, what are the selection criteria? What are the principles by which you would select metrics for the financial incentive of delivering the 5% to Christy and her hubs, for example? So now we start to get into the how do you measure something in the short term? How do you hold the ballroom dance vision here? Right? What are the principles? Just chew on that for a second, and you can review the slides that are in front of you if you'd like.
Can I ask that? So one strategy when you use some financial incentives is like you do that. You give this to somebody who's achieving what we want them to achieve. Another one is to incentivize going above and beyond. And a third is to really have something that's differentiating. Like a design parameter you're intentionally going in is you don't assume all 16 are going to get it. Like you have a design parameter that you're intentionally creating metrics that is going to differentiate amongst the groups, and that differentiation is intentionally trying to create competition. And it's intentionally designed that, from a funding point of view, you assume not everybody's going to get it. From an early learning council point of view, kind of when you guys are thinking about it and knowing where early learning hubs were there conversations about this parameter of, because you're setting a whole bunch of new cultures and tones, and so I get how you'd be like, we're going to set aside some that like you have to demonstrate something, but you may not want to go in this first round to like that, because that's a very different tone. So just the context would just be helpful for me in terms of like the council.
Bobby, do you want to answer that first? Since I usually jump in first, and then I can back clean up. Or
okay, I cannot think of a council conversation that has been that specific. So I can't speak for the council as a whole to the question of how we want to use the incentives. So I will share my own opinion that 3 is the closest principle to what, because it feels to me, I'm hearing what I think it's Brian and Colleen are saying about we can't lose why we're doing this, that we've got to change the lives of kids. But developmentally, the challenge is to behave differently than we have in the past. And my own personal view is that's going to be essential, because services by themselves are not going to get us where we want to go. We do not have enough money, nor will we ever have enough money, that the money itself is going to change the outcomes. So either the community working together owns the well-being of the children and changes behavior that's way beyond the little pieces of money that the public spends. If that doesn't happen, we're not going to reach these goals. So that's why I want the hubs to get, and it'd be great if all of them could show evidence, however we did it, that they understand that they have implemented collective impact on at least one issue related to well-being of children and families, and that what we could come up with evidence. And I would like everybody to be able to achieve it, and if they can't achieve it the first time, then that they be very clear that that's the most important thing for them to do. But that's Bobby, because I have not participated in a council conversation in which we came to consensus on this question.
So it's Pam. I will say that I agree with Bobby. We haven't had the specific conversation in the way that you laid it out and differentiated it, Colleen. However, we have had conversations to say we don't expect that all 16 are going to be successful in whatever we do. We have had conversations that say that in which we discuss, and I think reach some consensus that we are trying to change dynamic here and reward people who are really successful in changing the dynamic in their communities. And that's not going to be everybody all the time. And it might be Christy this time, and it might not, I'm going to keep picking on you, and it might not be Christy next time, right? Because dynamics change and you get new board of commissioners, or whatever it is. So I think I would tend to agree with Bobby that of your 3 options you laid out, it's more along the differentiator line, but it's not in the explicit sort of way that you laid it out. so with
And
that,
it's not like it's optional that that's their goal. I mean, I think that what they're trying to do is not optional. So the council won't be successful until every hub could get the financial incentive.
right. I think that's why I'm so passionate about having it tied to the ballroom dance, because the things are fundamentally not going to change until everybody's dancing ballroom in the state, right? So,
yeah, I think one of the tricks is the ballroom dance has subjective, and when you start getting into the money, then it's your subjective call of whether you subjectively think they agree. That's a very different ballgame than, you know, the proportion went from this, proportion control went from this, and it went to that. Like, there's no debate across, like, there's no judgment call by you, the program. And so that's usually, you know, calls come out differently when you start talking about it.
Well, I would hope that we could find a way to make this objective and not subjective. That we would, I mean, I don't think we should have a subjective measure. I think it will be incumbent on us to think of ways that are objectively measurable.
So I know this is sort of, that idea is implicit in 7, but it almost seems like the measure needs to be objective, needs to be called out as a particular principle for these, for this discussion.
as objective as possible.
And then I think to make sure that there's enough TA that everybody can use whatever, like whatever is measurable, like that all communities have access to that same data point.
Oh, I
way. Because that's where the subjective part comes in. Even though we say this is the measurable part, some people feel like they can't count those numbers the same way as another community can count the numbers.
So objective and equally available and accessible across the measure.
Everybody gets the same quality of the stamp instruction.
Yeah.
So is this a question about consistency of the measure across?
It is, yes. I think that's what I had in my.
Okay.
And then knowing that it's number 3 changes maybe the answer to my homework.
Yeah, and I think that's where for me, I have a little bit of a rub because I hear everybody saying something like 3, but when I look at your metrics and what people are reporting, I think they're not reporting quantifiable metrics to you. So there's a subjective assessment on your part. So that's where I have this like discordance where I'm like, yeah, I agree with you, Bobby, and I agree with you. But when I look at like what, you have to use the metrics we have now for this year's incentive. You can't have metrics, correct?
We don't necessarily.
Oh, I thought that was one of our first meetings.
That's a council prerogative, I assume.
You can recommend that the council do something. I'm making it up. I'm totally, completely making it up. But if this group were to, so Bobby, correct me if I'm wrong, but if this group were to say, you know, we think you need to have objective measures that are consistently measurable and available across, and what we're going to measure is that everybody has black dance shoes, and it's not part of that, and the council would consider it. I think we would, what the council will want to know is what's the degree of burden onto the hubs that are already doing really difficult work because we haven't told them.
And we're told this is the game, and you may not tell them until January, and it needs to be.
David's got the timeline in his brain, but I think we're fall.
I know you wanted them to have October, and it was going to take them 2 months, and they have to report to them. So you're saying like a January, and you have to, in addition to all the new reports, you have to also report this, and we have to get it out to you, whatever timeline it is, by June 1/7.
So let's come back to this. We're going to get to the metrics here in a second. In the best of all worlds, look at these 1 through 7. Which of these would you keep in terms of metrics tied to financial incentives
In the first round.
In the first round, right now. We're going to have objective and consistency, or at least that's what we're recommending. What of the other 7 that are here would you keep?
What I think is somewhat subjective and difficult given the metrics we have now, or a new metric, is the metrics should support a strengths-based approach to the work. I agree with that overall. I think that's going to be tricky to operationalize and align your metric relative to that.
Yeah. Anybody disagree? So we would delete number 6 for this purpose.
Yeah.
Again, this is this purpose. It's not. It's not a service purpose. It's a different purpose.
And I mean, the metrics should reflect the stages of development. That's why we asked the very fundamental. We asked the first question. You mean like for right now? Like we're already doing that. So I would say that is a very important principle to keep because we are recognizing
Which one?
The financial. Sorry, the 1, 2, 4.
Number 4.
We're recognizing what the financial, and this is like going to be hugely important in terms of messaging, just having lived on CCO incentive metric side, but like what the financial incentive metric is now isn't going to be what it's in the future because we're recognizing where you are now. I think.
So we're talking
I wonder if, following up on where we are developmentally, where the hubs are, and I'd like to hear from the hubs, do they think that they're old enough to have to achieve 2? That they could have put in place anything that would that looks developmentally not very likely.
Hi, this
In
is
the
Dorothy.
time frame? Go ahead.
Yeah, so this is Dorothy, and I think that it depends on the hub and what you mean by meaningful. I mean, that would be my feedback. I mean, I think that some hubs would feel like they were too young, and that there's been even if they're older than a year, for example, there's been enough a significant amount of work to get partners to come together that they may feel like they aren't able to show data that shows a meaningful difference for children, families, and the community because the bulk of the time has been spent building relationships to get to that point.
Okay. So no number 2. We could also, for this purpose, again, not for other purposes, but for this purpose, we could eliminate number 2. How about 5? I'm interested in hearing from the hubs about for this purpose, whether 5 is valid for this purpose, or is it too soon?
Could I ask whoever's typing if maybe their mic could be muted, or I don't know how that setup is. But the typing is really, really quite loud.
Thank you. I think it's somebody who's joining us by phone. It's not somebody who's here in the room. So.
Oh, thank you for clarifying that.
Okay. Anything else? I asked about number 5. Nobody responded except for Christy, who said it might kind of depend on what you're focusing in on. So can we go then to the next slide, which is the metrics that the hubs are currently operating under. Are they all on one slide, or do we have 2 slides? 2 slides. Okay. So maybe we can just digest for a second. Let's look at this slide just a second. Maybe make some notes, and then we'll look at the next slide. We'll do the same thing. And in particular, what I'd like you to think about is there anything that pops out here as a potential incentive metric, given everything that we've talked about today. We're going to have another conversation about this at our August meeting, so it's not the only opportunity. But given what we've talked about today, is there anything that pops out as potential? And we'll go to the next slide in just a second.
Just to clarify, are you perceiving that the incentives need to be one metric, or can you see that it would be a composite, that they have to have 1A, 1B, 2-1, and blah? And then
it could be, if there's been no conversation, if we think it should be a composite, we should recommend it to the council.
I can't imagine a comfort based on what we just said of like one thing is going to nail it. To me, I think it's going to need to be a composite. And I can see how maybe of that 5% people that have all 4 get one people. I see what you're saying. Because then you're telling them the message that it's breadth and depth as a parameter of us, and as an early learning council, what we care about. Because if you pick one, you're then telling them we weight this. And if you pick multiple and you give hubs more that have the multiple within the composite, and you make sure that there's parsimony across like 1 and 2, then you are explicitly telling them it's important to keep up parsimony across all these things. Yeah, like there was a reason you came up with them.
So I'm hearing another principle, and I want to figure out if I can capture it, that the incentive metric should support the breadth of the work. But that's not quite right.
Like if you only had incentive metrics in 1 and you didn't hit on the 3, to me I'm like you wouldn't. I think you need to have a composite, and the composite needs to have parsimony of the pieces across the goals.
So is it a composite of the metrics, not necessarily the 3? Right? It's
it's 1A, 1A, 1B, and then 1 and 2, and 1 and 3, so that you have you're not.
I got it now.
You're not weighting one over the other.
I sort of have the negative principle. I'm trying to. So the negative principle is the incentive shouldn't send a missed signal about the priority of one focus area. I'm trying to figure out how to put that into positive. Maybe we just leave it the negative version.
We can figure out maybe between now and August how to flip it.
Okay. But it felt like that needed to be captured as part of the principles that we're developing. Okay.
What I like about the idea of a composite is that it can include some of the existing metrics, which if I were a hub, there would be something reassuring about having things I already know I need to achieve in the incentive. So it would be more like, and I can see some of these lending themselves to it, but so it's increasing evidence that you're moving to collective impact. And the highest incentive is however we come up with an objective measure that they have it, but they could get credit for some of these other things that are in their current metrics to move them toward collective efficacy.
Yeah, and Bobby, you're saying we can set that up in the composite with a composite.
Right. I like that idea of a composite because I think it would be very reassuring to a hub to have things they already know they have to do in the incentive measure. But then the incentive measure should push them further.
Right.
Can I add another principle here? So one of the things I mean is that the incentive should build on work that the hubs have already been told to do, then add new work.
In this first
period. That seems like an important concept that I'm hearing from folks.
Yeah.
Okay.
Yep, that's good. So just one other parameter, like before I dive into detail. So one of the questions, well, and I don't think we need to answer it today, but we need to answer it now. There's 2 ways to do a composite. A composite is all or none, or a composite is depending upon your percentage to achieve within that composite, then you get a percentage of the fund. And those to different positive and negative consequences. So I think first you figure out what's in our composite, and then we can have a second conversation. And then the second design parameter is we're talking about parsimony across the 3 goals. There's another level of parsimony when you're talking about composite metrics is, do you want parsimony of the kind of metric? Yeah. So some of these are like what they report to you, or do they have a plan? And some of them later on will get to like a different type of metric. And so sometimes you want in a composite things that are derived from different type of metrics so that you're forcing, it intentionally forces the hub to collect different types of data. You're incentivizing that different data. You're not also weighting one data source over another.
Okay, so while we're on this slide, which of these metrics jump out at you for consideration as part of what we think might now be a composite? So I heard Colleen say 11A and 11B. Who else and what else? Just again, for consideration.
I didn't mean, I was just throwing those out.
Oh, I'm sorry.
For me, I was, yeah, okay, so if you're really looking at these, I have 11A and 11D. It has the number of children part for me. So I'm trying to operationalize our beginning of time parameter of collective action and what would show they're getting there.
So 11A and 11D are up for, have been nominated. Are there other items on this slide that you think should be up?
Well, I think C and D should be considered. I'm not ready to say they should be in it.
Yeah, right. This is just a consideration.
But it is just to be considered because they are the kinds of things that we have told them are evidence that they're moving to collective.
Yes. So far we have 11A, C, and D, cat and dog, apple, cat, dog. What else? Anything else? There's another slide yet that we need to get to. So I'm just, are there any other items on this slide that we should keep in consideration at this time?
I'd like to keep in 1.3.
Okay, 1.3, thank you. Anyone else? Okay, let's move to the next slide.
I'm going to toss in really quick 11E, the blend and blade resources, if we're thinking about accessing services.
Thank you. Great, thank you. What about, then let's go ahead and move to the next slide.
So these are the metrics for which they're intended to have quantifiable, quantitative data behind them. You can see that 3 have TBD behind them because they haven't been operationalized yet. So there are 5 in bold where we're currently collecting data and reporting it to the hub.
And 2.4 has a half TBD as well. It has a.
I feel very strongly given the data source that should not be.
2.4.
I'm seeing a lot of unintended negative consequences of that should be. Okay. Doing the homework, I had 1.4 on my mind.
I wonder if that's too early. That one actually ends up being a very challenging metric because our baseline for that currently is only available data from the state and state-funded programs, which hubs actually do not have control over the amount of slots in state-funded programs. So, I mean, even though we're tracking that and we're looking at it, it's something that is out of our realm of control.
How valid is 2.3? Like, how valid is the data? I see what it is, but how valid is it, and how comparable is it across the hub?
The number of providers is solid. Whether they are in hotspots or communities of color could be determined probably through some method. It hasn't been. The number of children being served is unknown.
And the 2.3, there may be an interesting question around consistency because hubs were given space to define those areas themselves. So there may be some consistency questions on it.
Because I guess my overall parameters, I want something from 2 because I want parsimony of the type of metric. But then again, you're getting to incentive where I feel better when it's a composite is you're not like waiting. The clause come out a little bit less of like, well, they're measuring difference. They planted the game. That's why they got it versus that's why we got it.
But why couldn't we just do the part of, to your point,
yeah.
Could we just do a portion of the portion of 2.3
That's where
we're confident in?
Yeah.
Can I speak to 2.3?
Yeah, please.
Okay, so as a quality improvement specialist under the QRIS system, working with the CCR&R in our county, what we need to do is each time we visit with a provider, we document that in a database. And then my director needs to take quarterly narratives that I give her and present them to the hub. So that's pretty valuable and pretty valid. The only thing is we don't have a quantitative measure of it except the data and engagement per visit, but there's definitely qualitative data to look at.
So is this Melly?
Yes.
Okay, that's because their CCR&R is receiving funding from our hub as a focused child care network. They're not a specific focused child care network, but we're measuring it in the same way. So for them, that's why they're doing it that way.
Right, but my point in bringing that up is in the blending of the research or the data to then show us a substantial engagement in the process, therefore aiding and increasing those numbers.
I think the worry that's being brought up, Millie, is that to our principle of consistency, that's something you can do, but that's not something that could be done. I'm picking out of the air. I mean, that might not be something that Four Rivers could do or that the Eastern Oregon hub could do. It's not something that's consistently done.
Okay, thank you for clarifying that.
Yeah. Well, so if we're going to go to Colleen's point, for parsimony across the three areas, it seems to me that our options really are, and maybe we decide we don't do that.
Or that's the feedback to the ELC that currently the metrics we have don't allow us to meet that principle.
Right, right. So we either, really the only options we have if we want to try to go for that is a portion of 2.3 and 3.1. Or 3.3, I guess we could do too. But
hi, this is Dorothy again. Wouldn't 2.4 be a consideration as well? Because if we're talking specifically about the OHP population, because we have a data source through the CCOs around developmental screens.
Colleen, that's softball for you.
I guess if we're talking about this, going back to our original principles of what the goal of the hub, what the incentive metrics are, is that they're honing in on the things that are at the core, something that is done differently, and that these early learning partners are interacting differently with each other and serving the population collectively differently. And so what goes into the composite is that sends a message about what things you're weighting. And if you ask me, do I think that developmental screening and coordination developmental screening among the core function, I would say there's parts of that, yes, but as it is measured right now, the denominator is continuously enroll people in that CCO, and the numerator is people that got a 96110. So what I get very uncomfortable with is you're weighting something that I don't think goes to that core design parameter and principle we just talked about. And I'm actually seeing in a number of communities unintended negative consequences that people are trying to figure out how to get 96110 counted and missing the entire point of developmental screening, which was how did the early learning hub address the risks identified in developmental screening and leverage these great community-based resources that are there. So that's my uncomfort, is that if you put it in an incentive metric, you may be further incentivizing something that doesn't get at the core of what we're trying to do.
But there are pieces of what we hear the hubs are doing that are so in line with this desired behavior. So, for instance, when the ASQs collected maybe by early learning providers are used by health providers, or when a health provider has a portal so that when partners do a screen, it goes in to and is used collectively. Or I don't know that anybody is far enough along, but I know what we're trying to get is that they don't end with the screening. They continue to look at whether they receive, for those who were defined as needing services, were they actually referred to an appropriate service, and did they actually engage? So I don't know, I mean, there's a whole lot of measurement issues, but what strikes me as maybe having potential is we know people are already working on this issue, and some...
And I mean, I guess I'll counter that, Bobby, is that's my whole point, is the work that they're doing to count these child cares isn't going to increase the percent of children who receive a developmental screen. It isn't. A majority, you know, even in one community where it's like 3,000 kids, a good chunk of those kids were already screened in another thing. And those providers getting them, majority of them aren't billing the 9610, or if they are, they're billing it for 600 kids, and the denominator for the metric is continuously enrolled Medicaid. So while it is happening, it's not moving that proportion measure. That proportion measure is a huge denominator. It's way bigger than the denominator that these have their responses.
But I wasn't talking about, Colleen, about measuring it, because I don't think we're there for all the reasons you said. But I think there are measurable behaviors like creating a portal or having, I don't know if anybody's doing this yet, but having a tracking system so that we know what happens to the child who was screened as needing a referral. I mean, things like those. I wasn't talking, I don't think we're at any point that it makes sense to measure how many kids are been screened, because for all, you know far better than I do all the reasons, but even I know we're not ready for that. But
so
some of those
are you suggesting a different metric? I mean, even if it's
not that metric. It's just in that conceptual area, and maybe I'm wrong, but I thought some communities were making, well, I know they are making substantive behavioral change across sectors so that eventually we will get children screened more effectively, referred more effectively, and receiving services, which is what it's all about. And where we are developmentally now is putting the structures into place.
So it's Pam. Sue has her hand up, and then I want to offer an option. I've got my eye on the clock and my mind on where this goes from here, and so I think I have an option for this. So Sue, let's get your comment in first.
I guess I was just listening to all this and thinking about that, you know, there's so much conversation at the hub level around the intention behind these metrics and what's actually going to make a difference for kids and what to measure. And I wonder if these incentive metrics are actually an opportunity to invite them to ask for a little bit of additional funding to start to further, and like I love that part, making substantive behavioral change to further the intention behind the metric. So maybe it's that they actually offer what they're doing that they think is going to move a metric, the intention behind the metric forward, and then some piece of funding that would help them explore that more, that would help us all understand as we're building the system what metrics actually in the long run are going to help us to measure the success of this system. Do you see what I'm trying to say?
Yeah, I think my potential path forward in this was a version of what you just said, which is, you know, if on the previous slide we agreed fairly readily that we should keep for consideration, not recommend yet, a series of potential metrics, which I'll review in just a second. But on this one, we're dancing around some really important issues. I think at some level, we agree that the data does not allow us to measure precisely what is here as a metric, and so tying it to the incentive makes it really difficult. But developmentally, where the hubs are, is that we want to, Bobby's language, or maybe whoever's language, we want to see measurable behavioral change in that integrated way that gets to these. And I wonder if there's a way for staff to play with that, kind of looking at David, between now and August, about if we had, 1-1A, B, 1-1A, C, D, and whatever else we ended up with on the previous slide, and some direction to help us think through or bring back a proposal for what could demonstrate measurable behavior change on the part of the hub and its communities for 2.3 and 3.3, or whatever we pick.
Yeah, I mean, I think I agree with that. I also think, because I remember this as a stressful conversation in the first round of the committee, and then second for me personally, because you're getting to numerator-denominator measurement issues.
Yeah.
Is I still don't fundamentally see the messages right. So there's still for me of like, even if you got the data right, I don't think the metric, like the topic is right.
And I was hearing Bobby and Colleen, I think, saying opposite things around this metric. And so it's a question of, is the metric sending the right incentive for action currently, I think is the debate. And I was hearing some difference of opinion on what's the incentive that this metric is currently creating.
Right. Yeah.
So I'm not sure how to resolve that from staff end, because it seems like
I'll fundamentally disagree that getting a database is the first step to the follow-up. I will fundamentally disagree with that, being very, very close to these communities that are being spotlighted on that. I don't believe that's true.
I think the intention behind the metric, when people start to think about the intention behind the metric, that there's any common sense of that, and then people are just trying these different things to see.
Like if you removed data source, would the intention be right?
Yeah, that when we talk about the increase in percentage of children who receive a developmental screen, right? The intention.
For me, the intention for a hub that would be aligned, but I'd be like, you got me, I'm on your side, is the intention across both health and early learning hub is that children who are screened and identified at risk receive follow-up services to address those services, because that's what's going to make them kindergarten ready. And so that's what I mean by the topic. If the metric was, if the metric itself was about that, I'm with you. But the metric is on this. It's on the screen part. There's no incentive anywhere on this part. So everyone's chasing this. But nobody's chasing, like, we got a heck of a lot of screens going on, and majority of kids aren't getting anything.
But doesn't it seem like potentially these assessment metrics could be an opportunity to play with what that original intention is, and see what hubs are doing to drive that and support their work in driving that to help shift these metrics over time so that it actually is tracking what.
But that's where the design parameter dance, if it has to be an existing metric or not, is the dance.
But I heard this with the principle earlier to your composite, that the composite is comprised of existing metrics and push the envelope metrics.
But so Pam, from a hub level, not all hubs are just focused on the number. So what we've done in our region, and we recently worked with Ford Family Foundation to implement a START training in Lincoln County, and had a panel discussion after the training for providers. So they were trained on ASQ, how to build for ASQ, but then had a panel discussion with early learning providers and early intervention after the training. And they were trained by early intervention. So now you get this ASQ that you have a concern about, and this is what we need from you to be able to do the follow-up and contact with the family. We had our largest provider over in Lincoln County that was not using ASQ previously go back to their office and change, and immediately implementation of ASQ. And early intervention within a week, 2 weeks, received 5 complete referrals, and follow-up for all of those kids happened within a week to 2 week time frame. So it wasn't about the number of ASQ that we're collecting, it's what we're doing with the ASQs.
So I'm mindful of the time, and we're going to quickly run out. Like you're in family therapy, like the good stuff comes 10 minutes before the end of the hour, right? So here we are. So I want to suggest, if there's no objection from staff, that we've actually made a lot of progress, and what we need to do is come back and look at it all wrapped together with some fantastic staff work between now and then. And so let me try to wrap it up, and then see. And I think the fantastic staff work is two types. It's number one, putting it all together into kind of a package about, is this what you want to move forward? How do you want to adjust this and move it forward as a recommendation to council? But it's also the second fantastic staff work is filling in the blanks in this conversation we're currently having. And so just to zero in on that for just a second before I try to summarize what I think we've done. I think we are, you all haven't said it this way, but I think we're trying to get at the intention behind the metric, the behavior change that we're trying to get to in communities that actually is parallel to how we measure people getting ready for the ballroom dance, really. I mean, right? So it's the fact that what Christy just described, that's a new behavior in Lincoln County. That's what we want to be incenting. There's a whole nother question about how we measure it. So, and I think we have said, although not this precisely, that it is both about the child care stuff that's represented up here in the QRIS and ERDC 2.3 and 3.1, and it's also about the interdigitation between early learning and healthcare, which is currently represented by 2.4 and 3.3. I don't care how that shakes out, but I think we have to have both a child, what's the behavior change on the child care end and what's the behavior change on the healthcare end. Right, I see heads nodding in the room. Okay, so let me just stop there and see if that's, David, can we ask staff to help us work on that?
Okay. So are the ones that are TBD, are they just out?
There's no way to measure them.
So for those, we knew there was no consistent data system, and what we simply just asked hubs is, if you have some ideas, suggestions for tracking them, let's take a look at what's happening in communities over this first year and revisit them. So we're just at the point to hearing from hubs on.
And I think that's all good, but if what we're putting in there is maybe other metrics that are not even in existence, I feel like that doesn't, it's still it's fine to keep them in still.
Because I think there's some of those are great. You want to incentivize.
Yeah. Because if we're already looking at metrics that people don't even know yet exist, we might as well just, at least they know these exist, I suppose.
Do the financial incentive metrics, I mean, is the goal here to choose ones where the hubs have identified baselines and targets? Or not necessarily?
No, not. In fact, I heard us say that on the developmental trajectory of a hub, we're not there. We probably can't do that yet, at least with all of what they call out. Yeah.
It almost seems to me like the incentive metric is more about rewarding innovative progress, I guess, because it's not necessarily that all the hubs will get it.
Or is it just encouraging progress? You know, that just the fact that this is heavy lifting, and there is a prize if you keep doing it.
Right. So the way I would use in the continued ballroom dance analogy, we want to reward people who are starting to do the dance.
I see.
Right? Maybe they're not winning the championship yet, but they're starting to do the dance. If we don't reward that, everybody's going to keep dancing because we have really good providers and everybody has good intentions, but we're going to dance separately and we never come together. So that's the behavior we're trying to incent and reward with this.
That's kind of why I like 1.4, because it leaves room for new programs that aren't even out there yet, right? And then to tally them.
All right, so let me try this on for size. Okay, so relative, I'm not going to try to summarize what we said earlier with the feedback that we gave staff on the accessing or the early learning system goal. I'm just going to try to do kind of all of this stuff around the incentive. So I think what we said is, in terms of what's the one thing that would tell us that hubs are succeeding is that they're starting to dance together, using the analogy. They're starting to dance together. We have a set of principles. Can we go back to the principle slide, Tom, for just a second? there you go. We have a set of principles that we're drawing from and altering and adjusting that by which we want to identify incentive metrics or metrics for the types of financial incentives would be a better way to say it. Those include what's on the slide up there. We would eliminate numbers 2, possibly 5, and 6. We would add objectivity. We would add consistency. David's going to take a shot at turning -1 into a +1. I can't even remember now how it's phrased, right? And we've sort of landed on this concept of a composite set of metrics by which we would draw from existing but add additional. Then, can you go fast forward again, Tom, to the first one? There you go. So of the existing metrics on this slide, we want to continue to consider 1.1a, C, D, and E, as well as 1.3. We flip to the next one. And then on the next slide here, there are a variety of these that we really like. What none of them do that we want them to do is to articulate the underlying changes, the change in behavior that underlies and forms the foundation for a community's ability to collectively achieve these metrics. And we need staff to help us identify probably 2, because the ones that were numbered at number 1, we're sort of pulling that out. And to get parsimony, to Colleen's point, across our composite, we at least want staff to help us identify potential underlying behavior that we could keep in consideration for the number 2s and the number 3.
Yeah, and we want feedback to the Early Learning Council that we think metrics related that have proportion and population metrics are really important. We're not sure if these are the best ones. Yeah, we're really excited to explore that after this initial. Yes,
and that will be this committee's next charge.
That's our learning of the report.
So David, can I ask you a question?
Sure.
2.5 has a TBD on it, and you said it's because we don't have measures. We don't have data.
Yes.
So what do you mean by enrolled in kindergarten before the start of the school year?
That ended up being part of the question, right? So one of the issues that we know from school districts is there's actually a lot of kids that show up for kindergarten actually after the first day of kindergarten. But there was original stuff that was actually measurable, but it turns out it depends a lot on the practices at the front desk when enrollment dates get put down.
Yeah. So can I? Oh, sorry. Go ahead.
Yeah. What I was going to say is that we do have data on that, but you're saying our data may be bad.
Yes.
Okay.
Well, I'll call it uninterpretable.
And which are you talking about? The data that ODE collects?
Yeah, so at least that was when we talked to ODE data folks around this data on further reflection. There was also just, it was too inconsistent on what that enrollment date actually meant and when it was, yeah. But if ODE can find a consistent answer to this, that would be wonderful.
Yeah, we should talk more about that.
Okay,
right.
That would be great.
So that's another piece of homework. All right. So is that a fair summary then of what we decided? We may actually made a lot of progress, and what we need to look at next time. Okay. So on our August agenda then would be looking at the.
And we actually, this committee does not have an official August meeting.
Oh,
we're meeting every other. We've been meeting every other month, but we could, if it makes sense, we could try to schedule a webinar for August. I don't know how plausible. I don't know how plausible that is. But yeah.
Yeah, people are going, I don't know, I guess not. Depends on what week. Yeah. All right. And so that's just me. Maybe it was wishful thinking. Sorry.
You could always send it to all. You just wait and leave. You have 2 people.
All right.
Let's try.
So it sounds like it's worth a try, and if not, maybe early in September, because I want to keep pushing this because the council needs to consider it, and we need to get it out to Hub.
Can I make a suggestion? Is that if we cannot have a meeting in August, which I think may end up being likely, we can design a set of, if the committee would be willing to participate, a set of sort of homework online activities to continue to get input and move the conversation further along.
Is that okay with everyone? All right.
Like we
Yeah, this is Melly, just real quick. So just to let you know, I am part of the public school system, so early September is going to be pretty packed for me with going back to school myself with our district, as you know, the teachers report. So any homework like that, I'm open to that big time.
Thank you. All right, so it sounds like we have a general plan. Thank you all for we did a lot in the last 10 minutes. Family therapy. Thank you. Really appreciate you being here. Appreciate your attentiveness for the last couple of hours, and especially those of you who were on the phone. Thank you very much. So we will talk to you one way or another, survey or what have you, in August.
Yeah.
Okay. Thanks, everybody.
Okay. Thank you.
Bye.
Bye.